Lascan Corla. Minister, I am very happy to present what I would call a very timely motion and a number of solutions-focused proposals to accompany this motion. This motion quantifies the scale of the issues that we're facing in regard to waiting lists and the numbers of people on trolleys, but it also proposes a number of solutions and actions that can be taken in both the short, the medium and the longer term in order to facilitate our health system to work in a more effective, efficient manner and certainly in a more timely manner. The motion itself recognises that 2022 was the worst year for overcrowding in Irish hospitals on record, with over 121,000 patients being left without a bed. The motion then goes on to detail the numbers without beds in certain hospitals. Limerick Hospital was the most overcrowded hospital in the country, in total over 18,000, followed by Cork University Hospital at over 12,000, University Hospital Galway over 10,000, Sligo University Hospital over 8,000 and St Vincent's over 7,000. So while this is a national motion, and it looks at it from a national perspective, it is interesting to note that 4 out of 5 of those hospitals, Minister, are along the Atlantic corridor. And that is an issue. If you look at trolley watch figures, day after day, week after week, we see that that's the case. But as well as that, the motion also states that 67,000 patients waited at least a day in emergency departments before being admitted during 2022, and that over 800,000 patients were on national public hospital waiting lists at the end of 2022. It also outlines the fact that 584,600 patients are waiting to be seen for the first time by a consultant in an outpatient clinic at the end of 2022. It goes on to say that the waiting list reduced by 4% last year, 2022. However, the government's own target was to reduce those waiting lists by 18%. You didn't even manage to get 25% of the way. And while it is some progress, what it does mean at the end of the day, that waiting lists are getting longer and longer. We also make the point that Ireland is a laggard in Europe for the digitalisation of our health system, and the introduction of electronic health records, the use of this kind of technology could significantly reduce triage times in EDs. I suspect also, Minister, it would make a real contribution to lessening the number of human errors that inevitably occur when you're working with a paper-based system. And while there may be issues around the fact that we had the cyber attack on the HSE just a few years ago, and that may have stalled this process somewhat, I think all of us would agree that digitalising the health system is a crucial part of having our system work in a more effective and efficient manner. The motion also states that there's a lack of specific national structure or control for clinical oversight in the care of people admitted to nursing homes, and they have difficulty accessing treatment by primary care teams. That's an area where you have expertise, Minister, and that is a significant problem in some nursing homes, and also that the lack of such oversight and care can then result in unnecessary presentations to EDs. Now, we also acknowledge that certain things have happened. It's not as if the government has sat on its hands. you have, for example, created an additional 7,176 patient slots per year across the UL Hospitals Group, following the recent introduction of a 7-day service at medical assessment units in Nina and St John's Hospital. We also acknowledge the ongoing recruitment by UL Hospitals Group for additional doctors, nurses, etc., and the changing of health service executive protocols to allow non-ED doctors access patients in the ED. We acknowledge the allocation by the Government of €350 million for the waiting list action plan in 2022. So this motion certainly acknowledges some of the actions that have been taken by government. But it also states, for example, Minister, that local injury units deliver efficient expert treatment to tens of thousands of patients with minor injuries every year, and that medical assessment units play an integral role in ED avoidance. So, Minister, in that context, we are calling on the Government to expand the medical assessment units to level 2 hospitals to a 24/7 service. And that's really important, because if people know that the service is 24/7, they're much more likely to attend at a level 2 hospital than going to a level 3 or 4 to the ED. And we're asking for a similar upscaling on the local injury units at level 2 hospitals, a 24/7 service. We're asking to appoint a designated medical officer in every nursing home to ensure that patients in nursing homes can access treatment by primary care teams. And finally, Minister, to procure or deliver an electronic health system to replace paper-based health records without further delay. Finally, can I say that the amendment put forward by Deputy Roisin Shortall on the elective hospitals and the need to speed up the construction of these hospitals certainly gets my full support. And now hand over to Deputy McNamara.